Hello, everyone, and welcome back to this session on classification and biomechanics of the skeletal muscles. I am Dr. Siddhanth Sawant, Associate Professor HOD for Kinesiotherapy and Physical Diagnosis Department at Sancheti Institute for Orthopaedics and Rehabilitation, College of Physiotherapy, Pune. And we have done with session one of this topic, and we have met again for session two. So, in the session one, what we discussed was basically there are three types of muscles that are present in the body. That is the skeletal muscle primarily, which are striated, cardiac muscles, which are specially striated, and the smooth muscles, which are non-striated. Apart from that, we spoke about the properties of the muscles. So there are predominantly five properties that we spoke of. One was irritability of the muscle. The next was contractility. The next one was relaxation, distensibility, and elasticity. So these were the five properties that we spoke of. Apart from that, we spoke about the factors that basically affect the muscle function of the skeletal muscles. So we said that the major muscle function of skeletal muscle is basically to cause movement. And what are the factors that are affecting this movement is what we are looking at right now. The first factor that we spoke about was architecture of the muscle. And under the architecture also, as a subsection, the first one that we spoke of was the basic arrangement of the myofibrils or the muscle fibers. Right now, we move on from that aspect. Under that also, we spoke about the types of the muscle fibers that were basically the parallel muscles. Then there was, again, in the parallel, there were two aspects. One was non-fusiform and the other one was fusiform. The non-fusiform, the basic example was a sartorius muscle. Fusiform muscle was an example was of a biceps brachii. Uh, Apart from that, then there were circular muscles that are basically guarding the orifices. Then there were like an orbicularis oris or an orbicularis oculi. Apart from that, there were convergent muscles which were present. That is one of the best examples of it was a pectoralis major, where it has a broad base or a broad origin to start with, but the fibers basically converge when it comes to the insertion. Moving on, then we spoke about the pination of the muscles, and we spoke about unipinnate muscles like an extensor digitorum, a bipinnate muscle that we spoke of that was rectus femoris, and we spoke about a multipinnate muscle that was a deltoid, for an example. So taking this as the base of our talk for today, we move on to the next aspect of classification, that is according to the myoglobin content. Now, predominantly, it is basically divided into red and white fibers. Red is something that contains more amount of red fibers, which are responsible for the movement and which are basically required for slow action, which can prolong for a long amount of time. So these are basically your anti-gravity muscles. And white are something that have lesser amount of myoglobin content, and they have their action is more of rapid and quick in nature, and they are present to perform some major mobility actions with us. So according to myoglobin content, there are basically two aspects, that is either red, where the myoglobin content is high, or white, where the myoglobin content is low. Apart from that, there are basically muscle fibers which are present. Now there are fast fibers, which are 2A fibers, which contract very quickly. They are large diameter fibers, which are large glycogen reserves. However, they have very few mitochondria. So why is this important to us is because they are the ones that can cause a strong contraction, but they are the ones which cannot sustain the strong contraction for a long amount of time. So they fatigue very quickly. The second type are the intermediate fibers. But before going towards that, let's go on to the third type and we'll come back to the intermediate type. So we're talking about the slow fibers, that is the type 1 fibers. Type 1 fibers are slow fibers because they tend to contract slowly. They are slow to fatigue because they have a rich mitochondria backup, and they have a very high oxygen supply to it, because again they contain very high myoglobin with them. So again, they are the ones which can sustain the contraction, but however, since they are very slow at contraction, the amount of contraction or the amount of tension that they produce is not very strong. with them. But nevertheless, they are the ones that basically sustain the activity over a period of time. Now, between these two fast fibers and slow fibers are intermediate fibers. These intermediate fibers are mid-size, they have low myoglobin content, and they have more capillaries than fast fibers, and because they are slower to fatigue. That is something that helps them, even though with a low myoglobin content, because the blood supply is rich to them, they automatically tend to go for a slower fatigue compared to your fast fibers. Now, why is this important for us to study, especially at this level, is because you have to understand one thing, that when I'm talking about these fast fibers, intermediate fibers, or slow fibers, no particular muscle is basically having a typical type of a muscle fiber, that is fast fiber or an intermediate fiber or a slow fiber. They will always have a combination of three of them together. Now, this combination basically depends upon your genetic type. It depends upon the way you're training the muscle. And that is the reason why this classification falls to be one of the most important ones. When an athlete will come, or when they choose an athlete, they basically decide it depending upon these fibers. They basically play a very, let's take an example. Somebody who has a good amount of fast fibers will do wonders when it comes to small sprints, that is 100 meter or a relay. But someone who has more amount of slow fibers with them, they will do wonders when it comes to your marathon, because in marathon you want a muscle structure, that a muscle function that is sustained over a period of time, and that is something that is very important to understand with respect to the fast fibers and slow fibers concept. Next type of classification is depending upon the contractile activity that a muscle gives. Contractile activity is, there are basically two major aspects to it. One is tonic and the other one is phasic. A tonic muscle is predominantly called as a stabilizer. What do I mean by stabilizer? It basically demonstrates continuous low level of contractile activity. So somewhere down the line, it keeps going, the muscle work is going on behind, but you do not feel that fatigue immediately. One of the best examples of this is the fact that if I'm sitting in one place, I'm sitting erect without any support, I'm just sitting on a table without a backrest, and I'm able to talk to you, is because there are tonic muscles that are present in my back which are helping me to sit erect. And that is the example of a tonic muscle. Yes, when you tend to do this for a sustained period of time, you feel that fatigue, but you can sustain this motion for a longer amount of time, compared to something called as a phasic muscle. A phasic muscle is a mobilizer. It demonstrates rapid action activity, which is required when you're changing positions from one place to the other. Now, suppose if I have to say pick up a 10 kg box and I have to suppose to keep it in one place, I can do it for the first time, I can do it for the second time, but over a period of time, as and when I keep going in, I will start getting fatigued, because this is a phasic activity of the muscle that I talk about. That is, you're trying to have a stronger contraction for a shorter amount of time, but when you tend to do it repeatedly, the muscle tends to go in fatigue. So your phasic muscles are primarily your mobilizers, whereas your tonic muscles are your stabilizers. Moving on to the muscle fiber types. Okay, so there are something called as a slow twitch fibers that we spoke of, and a large or a fast twitch fibers that we spoke of. Now, when I talk about these muscles, now what we'll be doing is we'll be combining these two classifications that we had. That is, going back quickly. We spoke about the fast fibers that are fast fibers, intermediate fibers, and slow fibers, and we spoke of tonic muscles and phasic muscles as well. So what we'll do is we'll quickly merge these two and we'll see how they are placed. So to simplify this slide, we basically have this table with us. That is the type 1 fibers, type 2A or intermediate, and type 2B. That is the fast type of fibers. So now when I talk about the type 1 fibers, the diameter of these fibers is medium because they're small diameter fibers, as we had already discussed, whereas the intermediate and the fast were basically large muscle fibers, whereas the force capacity was, if you divide it for according to the force capacity, The type 1 fibers have low force capacity, whereas the type 2A, that is the intermediate, and the type 2B, that is the fast, basically has a moderate to high capacity, as you can see it on the screens. Whereas the myosin ATPase activity is basically low in these muscle fibers, whereas in your fast muscle fibers or intermediate muscle fibers, it's high. The myoglobin content is exactly reverse. It goes as high over here and low at the fast muscle fibers. And the metabolic properties are basically they are more of oxidative in nature. So this is more of your biochemistry of first year, where the type 1 fibers depend a lot on your aerobic uh, force production or aerobic energy generation. Whereas your intermediate fibers depends upon the both, that is anaerobic and aerobic, and your type 2 fibers, that is the fast twitch fibers, predominantly depend upon your anaerobic cycle. When I talk about fatigue, when I talk about fatigability of the muscle, fatigability is they are highly resistant to uh, to the action. So they will not get fatigued easily. That I'm talking about the slow muscle fibers. The fast and the intermediate fibers have low fatigability. So they are the ones who will get fatigued early. So as I'm talking about these two classifications, the tonic muscles tend to be the more stabilizers. They tend to be more of with the type 1 fibers or type 2A fibers, intermediate. Whereas when I'm talking about the phasic muscles, they are more of the white fibers that are fast twitch fibers, and they also have a content of intermediate fibers with them. So that's the muscle fiber classification at a stretch for you. Moving on, this is something that is special to me, and it's the classification of according to the magnitude of their stabilizing and rotatory components. So in this, we divide the muscles as spurting and shunting. Now, what do I mean by spurting? Spurting is a muscle which is mainly a rotatory muscle which have their origin away from the joint and their insertion near to the joint. So an example that is taken over here is a biceps muscle. So now, as we know that a biceps brachii basically in the upper quadrant basically originates from the supraglenoid tubercle of the shoulder, and it transverses all the way from the shoulder, and it comes and sits, it crosses the elbow joint, and it sits on the radius. So that's your biceps brachii muscle. And when I talk about the spurting action of biceps brachii, it is at the elbow with respect to the elbow, that the origin is far away at the shoulder, but the insertion is near the joint. So this muscle will have more of a rotatory component at the shoulder joint. And as we see it, the biceps muscle basically is one of the major, after 70 degrees of flexion, it is one of the major distractor of the elbow joint because it causes, is a major mobility muscle, to put it short. On the other hand, when I'm talking about the shunting of the muscle is basically they are the stabilizers of the muscle. So they are the ones which will originate near the joint and they will move further away from the joint. So the insertion is going to be further away from the joint. So then example of a here is again we're talking about the same joint, that is the elbow joint, and the muscle is brachioradialis. So brachioradialis as a muscle which originates near the elbow joint but inserts further away near the wrist joint is a muscle that will act as a stabilizer at the elbow joint. Now, to slightly complicate the things with a level further is let's take the example of biceps brachii again. So if you realize biceps brachii at the elbow basically works as a spurting muscle. But a very interesting fact is a biceps brachii that originates near the shoulder joint will act as a shunting muscle. Now, who says this is basically if you read about Cynthia Norkins and the dynamic stabilizers of the shoulder joint, biceps brachii is one of the dynamic stabilizers at the shoulder joint. So, biceps brachii is an example of both spurting as well as shunting of a muscle. It acts as a spurt at the elbow joint, but it acts as a shunt at the shoulder joint. And moving on, the next classification is depending upon the location of the muscle. So the muscle is located either on the anterior aspect to a joint, or maybe to the depending upon the anterior aspect to the joint, which can be caused as a flexor. It can be caused as an extensor if it's placed on the posterior aspect. So depending upon where the muscles are getting placed, they can be called. Now this can be changed slightly as well, because the anterior aspect of the knee joint has the extensors, whereas the posterior aspect has the flexors. And it's exactly reverse when it comes to the upper extremity. When I talk about an anatomical position, that the anterior aspect has the flexors of the wrist, the long flexors of the wrist and the fingers, and the extensors on the posterior aspect. Moving on from there, the next classification is according to the number of joints a muscle crosses. So it is basically depending upon if the joint is a single joint muscle, that is something called as the example of this is a vastae or a soleus. Vastae is basically either of the ones, like the intermediate or the medial vastus lateralis, or the vastus medialis, as you can see on the screen. So these are the one joint muscles. The two joint muscles are, say, rectus femoris or your gastrocnemius. These are two joint muscles. Again, why are two joint muscles and multi-joint muscles important is because they tend to cross multiple joints. So the influence of one joint will have, or the position of one joint will have an influence of the muscle action at the other joint. So that is what you need to remember. That one joint muscle will be independent of the positions of the proximal and the distal joints, but the two joint and the multi-joint muscles will be under the influence of the position of the proximal or the distal joint, depending upon the muscle that is getting activated. A multi-joint muscle is the long finger flexors. Why are they called multi-joints is because they basically, when I'm talking about my long finger flexors, say let's take example of your flexor digitorum profundus. The profundus basically finds its origin above the elbow on the common flexor origin on the medial epicondyle of the humerus. It crosses the elbow joint. It goes and it travels on the anterior aspect of the forearm. It crosses the wrist joint, and then it crosses the metacarpophalangeal. It crosses the proximal phalangeal joint, interphalangeal joint, and then it comes out after the flexor digitorum superficialis splitting up. The profundus comes up and sits at the base of your distal phalanx. So the joints that it crosses are predominantly your elbow, your wrist, your metacarpophalangeal, your proximal interphalangeal, and the distal interphalangeal. That is the PIPs and the DIPs, the way we like to call it. So that is a multi-joint muscle for you. And lastly, according to the type of the muscle action, it depends upon, this is something that is important, and I would like to spend some time on it. So depending upon the action that is getting caused, these four definitions are decided. That is ergonist, antagonist, synergists, and fixators. So a ergonist is the muscle that basically causes the action primarily, and antagonist is the exactly opposite group of muscle to the ergonist. Synergist is something that will basically help uh, the muscle to cause the action, and fixators are the ones which will stabilize the joint when the muscles are getting contracted or the muscles are getting acted upon. So when I'm talking about an ergonomist, let's take an example of, say, elbow flexion. For an elbow flexion, my ergonomist is going to be, say, biceps brachii. If I'm causing my elbow flexion with a supinated arm, it's going to be biceps brachii. That is going to be my ergonomist. My antagonist is going to be my triceps. My synergist is going to be my brachialis muscle. And my fixator at the elbow joint or stabilizer, as we saw it in the shunting, is going to be my brachioradialis muscle. So now this basically changes according to the muscle requirement as well, or according to the action that the muscle that is causing. So if I'm causing the exactly opposite action, say I'm causing an elbow extension, at that time my antagonist is going to be my biceps brachii, whereas my ergonist is going to be my triceps brachii. So that's how the role of the muscles changes. Now, as a homework quickly, just think about it, that are the fixators and the stabilizers same? Are they same or are they different? Think about it, and if you find the answer, and if you think they're same, then still comment, and if you feel that they're different, then still drop a comment and let me know the difference between the two or the similarity between them. It can be either of the ones, so decide. So with this, we come to an end of the first session of the first few sessions of your muscle mechanics, where we are talking about the structure of the muscle mechanics. In today's session, we spoke about the red and the white muscle fibers. We predominantly spoke about the fast twitch, the intermediate twitch, and the slow twitch fibers. That was type 2A, type 2B, and type 1. And followed by that, we spoke about shunting and spurting. We spoke about the tonic and the phasic muscles. We spoke about the classification depending upon the structure, the placement of the muscles. That is, if they are placed anteriorly on the forearm, they become the flexors. But if they are placed anteriorly on the lower limb, they become the extensors. We spoke about the number of joints that the muscle crosses. We spoke about the type of the muscle action the muscle has. That is, it can be either an ergonist or an antagonist, synergist or a fixator. So I hope you guys had a fun session learning about the muscle structure right now. We'll be talking and we'll be continuing this topic further with respect to your muscle mechanics when I speak about uh, the length tension relationship, when we speak about the other mechanical factors, that is the motor units, when we speak about force velocity relationship. So these are the factors that actually cause or affect a muscle tension production. So we'll be talking about that, and we'll of course be talking about the types of contractions as well. So stay tuned for the upcoming sessions as well. And it was great connecting with each and every one of you. So hope you had a fun loving session. And I would like to thank Dr. Parag Sancheti sir. I would like to thank Mrs. Manisha Sangvi ma'am. And I would like to thank Dr. Apurva Shimpi sir and the entire team of Physio TV for giving me this wonderful opportunity of interacting with the new crowd. And thank you so much, everyone. Have a great day.